Good morning, Pat.
Good morning, Shayna. How are you?
I'm good. How are you?
I'm good, and I'm glad to be here today.
I'll ask some questions as need be, just to kind of make sure I understand what we're talking about from a candidate's perspective.
Okay, great. Let's get started. Hello, everybody, and welcome. Thank you for tuning into this presentation on case selection. It seems that case selection is the area where there's more questions than anything else in the exam. So let's start with that and start with the basics. What is in the case selection? Really pretty straightforward. It's a full quadrant, which would be a primary quadrant. In that quadrant, there must be 6 natural permanent teeth, and there must be a molar in that quadrant. The second quadrant can be any other quadrant in the mouth. There must be 2 posterior teeth, and one of those has to be a molar. Those 2 posterior teeth do not have to be in contact with one another, as long as you have the molar contact requirement fulfilled. And what that is there must be 2 molars in the mouth, and one must have both a mesial and distal contact. The second molar can have only one contact. So as long as that requirement is fulfilled, you have all of the things necessary for your case selection. A full primary quadrant, a secondary quadrant with 2 posterior teeth. Here's a visual of that case selection. You can see here, there's a primary quadrant of 8 teeth, and the opposing side of the mouth is where the 2 posterior teeth are for the secondary quadrant. Those two teeth could be in either of the other quadrants too. You can just choose surfaces or choose teeth where there is calculus. So 2 quadrants is the maximum for case selection.
Hey, Pat, in that second quadrant, though, you're only allowed 2 teeth, whether it's 2 consecutive teeth or a premolar and a molar, but it's only 2 teeth from that secondary quadrant, correct?
Correct. It is only those 2 teeth.
Okay.
A primary quadrant and 2 teeth from a second quadrant.
Great. Thanks.
There is a calculus distribution requirement. You know you have to have 12 surfaces of qualifying calculus for the calculus removal exercise. Those surfaces of calculus have to be distributed proportionately. So of those 12 surfaces of calculus that are the requirement, 8 of them have to be on posterior teeth. 5 of those 8 have to be on proximal surfaces of the posterior teeth, and 3 of those have to be on proximal surfaces of molars. So this is what we call the 8-5-3 rule. And as was pointed out, that this is the minimum requirement. It's not the maximum. It doesn't say that you have to have 8 on posterior, or you do, but or that you can't have more than 8. All of your surfaces, all 12 can be on posterior teeth. All 12 could be on proximal surfaces of molars. But this is the minimal distribution requirement that must be fulfilled for the examination. In the 12 surfaces of qualifying calculus that you're going to be selecting to remove the calculus as part of the calculus removal exercise can be on any of the teeth within the case selection. So they can be on any of the teeth in the primary quadrant, and you can utilize those 2 teeth in the secondary quadrant. There's no limit to the number of surfaces that you select in either quadrant. The only limitation is that, as I mentioned before, you can only use 2 quadrants in the case selection, a primary quadrant and 1 secondary quadrant.
So there could really be 8 surfaces of calculus on my 2 teeth in the secondary quadrant if there was calculus on the mesial, distal, facial, and lingual. Is that correct?
That is correct. If you selected, say, 2 molars as the 2 teeth in the secondary quadrant, and you're able to get your 3 proximal surfaces on molars on those 2 teeth, yes, you could get up to 8 surfaces.
Okay, thanks.
Yeah, and that would work. Might shock the examiners when they first see the case selection worksheet, but yes, can be done.
Okay.
So there are some situations that in the mouth that we say you cannot include as part of your 12 qualifying surfaces of calculus. It's implants, it's partially erupted third molars, and primary teeth. These can be, I want to make the distinction, these can be within your case selection, so they could be in the primary quadrant, but they cannot be selected as teeth from which you're going to choose your 12 surfaces for the to remove the calculus. These teeth, implants, partially erupted third molars, and primary teeth, cannot be treated for calculus removal requirements of the 12 surfaces. Then there's another host of situations that we don't say that you cannot, but we strongly encourage that you avoid, whenever possible, any retained primary teeth with anything with gross caries, extensive periodontal disease, multiple areas of deep pockets of 6 millimeters or more, or defective restorations. All of these items or these situations are just going to increase your risk in treating those teeth. If you're scaling a tooth with gross caries and the walls are fragile, the tooth could collapse. You could be scaling a tooth with mobility and it could come out. All of those things are just big risk factors. And so we say, if you can avoid that, do yourself a favor and don't choose these types of situations within your case selection. Just trying to reduce the odds of anything disastrous happening while you're treating the patient, disastrous for your nerves and disastrous or not beneficial to the patient. So implants, third molars, and primary teeth may not be used, and strongly discouraged is this other list, and it's for your benefit.
Now, Pat, if I do have a tooth, though, that has occlusal caries or an incipient lesion on the mesial or distal, I'm still able to use that tooth, correct?
Absolutely. Incipient, or what we're talking about here, are gross caries.
Okay.
Where the crown of the tooth is really broken down, and it would just be difficult and probably painful for the patient to be treated.
All right. Thank you.
Welcome. If there is a fully erupted third molar in the primary quadrant, you must include it in your case selection. If it is partially erupted, no, but if it is fully erupted, you must. If you're including it in your case selection, you do not have to select one of your 12 surfaces for removal from that tooth, but you will have to treat that tooth as you will all of the other teeth within the case selection. If there's a third molar in the secondary quadrant, then you just don't select that as being in your case selection. And so what we're really talking about here is that primary molar that third molar in your primary quadrant. So what do we mean by a partially erupted molar? If a third molar demonstrates any of these following conditions, we consider it not fully erupted, and therefore you should not select it as a tooth to treat. It's not to the benefit of the patient for you to treat that. If there's any soft tissue covering any part of the occlusal surface, we would call that partially erupted. If the soft tissue is to the level of the occlusal surface on the distal, now I have a picture of that I'm going to show you in just a few minutes, but even if there's no tissue covering the occlusal, but the tissue to the distal does come up to the occlusal surface, and there's usually a gap in between there, a pocket, we would say consider that to be partially erupted. Or if the occlusal plane of that tooth is not in alignment yet with the other occlusal surfaces of the teeth, that's the third criteria for partially erupted. So if the third molar in your patient's mouth fulfills any of these three criteria, then it would be considered partially erupted and you would not treat it. So when you're checking in with the DSM and you're asked, will you be treating the third molar? You would say no. And if you say no, then that tooth you do not have to treat. It will not be assigned for any surfaces. It just would be as if it's not in the mouth. It doesn't have to be treated at all. But On the other hand, if the third molar in the mouth does not fulfill these requirements, then you are required to treat it. So here's a nice image of a third molar that there's no tissue on the occlusal surface. The occlusal plane is even, but if you look in the back, there's that flap of soft tissue that does come up and reach the occlusal, the edge of the occlusal surface. So we would consider that to be a partially erupted tooth and a tooth that you would not treat. The case selection worksheet is a sheet for you to help get organized. It's in the manual. This is a worksheet that you use ahead of time when you've identified your case selection and the 12 surfaces that you're going to be submitting for calculus removal. Mm-hmm. On the sheet, you're going to select the quadrant that you're going to be treating, your primary quadrant, and then there's 2 lines for you to add the 2 teeth from the second quadrant. In this case, it's tooth number 12 and tooth number 14. Now, these teeth can be utilized as part of your 12 surfaces or not. Again, you can choose any teeth in your case selection. So look to the left, there's a column of 12 surfaces, and you would individually list each surface, starting with the tooth, and these are arranged numerically in ascending order. So in this particular case, the candidate did select surfaces on the 2 teeth in the secondary quadrant. You can see that there's a 12 distal and a 14 mesial. And then the other surfaces are from the primary quadrant. You can fill this out and then go online and enter your surfaces into the grading system electronically. You put them into your profile. This needs to be done 48 hours before the beginning of the exam. When you enter them, if your 12 surfaces do not fulfill that 853 requirement, that distribution, then you're going to get an error message, and it's going to tell you what the error is. You have too many anterior teeth, not enough surfaces on proximal surfaces of molars, whatever it may be. You then can make the correction and re-enter your case selection into your profile. There are no point deductions. You can keep doing that until you get it right, and nobody will know but you, so don't panic about it. Sometimes you're just entering and you enter a wrong surface. So the grading system will not accept a case selection that does not have surfaces that fulfill the 853 distribution rule. You will get a printout, and you want to bring these printouts with you, this version here of a case selection worksheet, or the one that you print out when you enter your surfaces online. Bring them to registration, and you always bring them when you meet the DSM. The first examiner is going to add 2 additional surfaces of qualifying calculus, if possible, to the 12 surfaces which you have already selected. So that case selection worksheet has the 12 surfaces, and that is what you are going to submit. The DSM is going to either enter or confirm those teeth in the grading platform. And when the examiners, the first examiner starts the pre-treatment evaluation process, that examiner is going to look for 2 additional surfaces from within your case selection that have calculus. And they're going to add those 2 surfaces to your 12 surfaces, making a total of 14. The examination is based, and you will be graded on 12 surfaces. But with the addition of 2 surfaces from the examiners, it's giving you 14 opportunities to find those 12 surfaces. So if by chance there is an error and one of the surfaces that you submit is not validated, meaning 2 examiners don't agree or 2 examiners agree that there is no calculus there, then that's not going to count that's not going to be able to be included as part of the exam. But if the examiners have selected 2 additional teeth, one of those teeth can come in and substitute for that surface that was not validated that you had entered. So it gives you the 14 opportunities to get those 12 surfaces. It's a safety net. It's a bonus. It's an aid to you for 2 additional surfaces. So if you do have errors, this will offset those errors. So if you have an opportunity to select a primary quadrant that has only calculus or calculus only on the surfaces that you're submitting, those 12 surfaces, or you can choose another quadrant as a primary quadrant that has additional calculus, it's your best interest to choose the one that has additional surfaces of calculus so that the examiners have other surfaces with calculus that they can include to, as I say, to give you that boost. If an examiner cannot find any additional surfaces, there is no penalty to you. The exam will just go forward with the 12 surfaces that you submit. As I say, there's no penalty, and the exam will go on as is. As I told you before, you're going to be graded on just 12 surfaces, not the 14. The grading system, if all 14 surfaces are validated, the grading system will choose 12 of the 14.
And as a candidate, I'm not informed which 12 are the final result of the computer selection, correct?
Correct. These 2 additional surfaces will be selected from within your case selection. And the computer selects which 12 are going to be the final assignment. So you will treat this is the importance of treating every tooth within that case selection as if it were one of your 12 surfaces, because it may be. The computer may select your 12, it may select 11 of yours and 1 of the examiners. It could do 2 of the examiners and 10 of yours. You don't know, but it is within the case selection. And whenever possible, it would be within that 853 distribution.
Well, as a candidate, I think it would be a relief to just know that I'm just treating a primary quadrant and 2 teeth as my case selection, and that I don't have to focus on making sure I scaled the right surface and didn't miss one. I'm treating the primary quadrant and 2 teeth in my case selection, and that's all I need to be worried about once the patient returns.
Exactly, and that's, I think, really the best way to look at it, is not just checking and just doing your 12 surfaces. Just start as you normally would do in clinic and just treat that entire primary quadrant and those 2 teeth. Yeah, good point, Jana. Another part of the examination is the calculus detection assignment. Those 12 surfaces that we just talked about, their purpose of those is for calculus removal, to demonstrate that you can remove calculus. There's another assignment called this calculus detection assignment where you show your skills for detecting calculus. At pre-treatment evaluation, you're going to be assigned 3 teeth on which to do calculus detection. The assignment is going to most likely be outside of the case selection, so it's not going to be in your primary quadrant or those 2 teeth. It'll be in a 3rd quadrant. What you will do is evaluate the 4 surfaces of those 3 teeth, so for a total of 12 surfaces, and you are going to indicate if there is calculus present, if there is qualifying calculus, and no, there is no calculus if it's not qualifying calculus. So the thing to understand here is that that it must be qualifying calculus. So if you feel something that's light or grainy, then the answer would be no, there is no calculus. But if you feel something the same quality of the calculus that's on your 12 surfaces, then your answer is yes. So this assignment will be given to you at pre-treatment. It'll be written right here on this slide. It shows what it looks like on the progress form. You'll be given the teeth, and then you will explore for calculus, and you will indicate yes or no, remembering that qualifying calculus is the standard that you're looking for. And
they're doing that prior to scaling?
Yes. Thank you. as soon as you get back, as soon as your patient is returned to you from pretreatment evaluation and you have this assignment, the very first thing to do is to do your calculus detection exercise. The CFE will also be telling you to do that. We'll also tell you to do that when we are at registration. The reason we want to really emphasize to do that procedure first is because if in the rare instance the 3 teeth or a couple of those 3 teeth happen to be within your case selection for whatever reason, then if you start to scale and you start removing calculus, and then you remember to do your calculus detection assignment and you go back and you've removed the calculus, it's hard for you to do that. So the very first thing when the patient is returned from pretreatment evaluation, when you see your assignment for calculus detection, do that exercise right away. Mark your findings on the progress form, and then move on to removing the calculus.
Thanks, Pat.
The third exercise that we're doing is periodontal measurements. Now, I've just emphasized that your calculus detection is going to be done pre-treatment, and now I'm telling you that this periodontal measurement is done post-treatment. We want you to probe teeth after all of the calculus has been removed. The readings that you get are going to be more accurate than trying to probe in an area that's filled with calculus. You will receive the assignment. The lower left-hand corner of this slide shows the progress form. You'll receive the assignment of teeth 8 and 14. And when you finish your treatment, your scaling and polishing and flossing and everything that you're going to do, then pick up your probe and probe the lingual surfaces of these 2 teeth. You're going to put the measurements not on the progress form, but on the back side of your case selection worksheet, and it will look like the bottom right-hand side of this slide. It'll say probing measurement findings. It will have the boxes for the 2 teeth, 8 and 14, and then you will record your 3 lingual readings. You'll take this, when you go to the evaluation area for post-treatment evaluation, you'll bring this case selection worksheet with you. The DSM will enter these readings that you found, and you'll take this case selection worksheet back with you to your operatory. So the periodontal measurement will be assigned pre-treatment. It will be 2 teeth, 1 anterior, 1 posterior. You will do the measurements after scaling and record on the back of the case selection worksheet. If after pre-treatment evaluation, it's determined that a candidate has not accrued enough points to possibly pass, and the passing score is 75, the examination will be stopped, and unfortunately the candidate will fail. So this would happen after the 3rd examiner completes the evaluation. A chief will be called, and basically what it means is that you did not have enough surfaces of calculus that were verified by examiners, or in a combination of maybe that your as the teeth that were validated did not fulfill that 853 requirement. But if you are not going to be able to pass, it is not fair to put the patient through treatment that is not needed for an opportunity to just do an examination. So that examination will be stopped at pre-treatment. And you will be told, and your patient will be told. So let's just hope that this doesn't happen, that we've gone over case selection enough that you understand it, that you know the importance of having those 12 surfaces, that you submit a quadrant that has additional calculus so the examiners can help you out by giving you 2 more surfaces, and we don't have to deal with this issue of stopping the exam. This is a map as of right now. By taking the ADEX exam, this is where you can be traveling. This is where you will be eligible to get licensure, so you can pack your suitcase and be ready to go. If you have additional questions, Shane is going to tell you where to direct them.
So candidates, you can, as you see on the screen, you can reach out to director@cdcaexams.org. And educators, if you have any additional questions, you can reach out to me at soverfelt@cdcaexams.org. We have absolutely enjoyed having you all this morning. It may be afternoon where you are, but we look forward to continuing this process And please check out a few of our other webinars that'll be available at cdcaexams.org as well. Thank you, Pat. This was good times.
Well, thank you. I'd just like to add one comment. If you do have questions, please submit them. Because if you have questions after reading the manual and after listening to this presentation and doing the candidate orientation, it means that we're not getting our point across well enough. So if you do have questions, please send them in so that we can alter our information to cover the questions. Good luck to all of you taking the exam. I hope you'll tune in to all of our presentations, as Shana said. Thank you.
Bye.
Bye.